Hi there, welcome back. Thank you for joining me again today. Let's start today with one big cleansing breath. Thank you so much for joining me in that. Today we're going to be talking about a subject that a lot of you have, which is, what is a dosing experience like? Well, I want to take you through it step by step. So this might be a little bit longer of a video, but I think it's going to have a lot of information for you, especially if maybe this is your first dose or you're not quite getting everything that you want to get out of the medicine. This might be a good video for you. So first of all, what we need to do is we need to prep. I have a video about setting, which is really important, but you also need to prepare for this event. It shouldn't be something you do last minute. It should be done with intention. So if you plan on doing it on Thursday, you should be thinking about this on Wednesday. If you should be preparing yourself on Thursday, you should do a small mini fast, which, like, if you're doing it in the evening, you want to eat sort of a light lunch and then not have too much food after for about 4 hours, because the medicine can make us nauseous and we don't want to have any tummy upsets during this the session or after the session. So that's the reason for the fast. But also during that period, this is your sacred time. Take that sacred time to think about your intention. Your intention is very important. If you do not have an intention, you're going to struggle with the medicine doing what you want it to do. So your intention can be almost anything you'd like, but with my clients, I encourage them to pick a broad intention, like to understand my relationships better, to be more present when I'm with my family. Those kinds of intentions are broad, and we can see them happen in our lives in very cool and interesting ways. So I want you to think about your intention during this period. I'm not saying meditate for a whole day. I'm not saying that, but have some awareness. Jot it down in your journal if you journal. If you don't journal, do whatever you do. If you do voice notes, whatever you do, or maybe just make mental notes, do those. Okay, so we want to think about our intention. So then after, when we prepared, let's say we're going to do it Thursday, I also encourage people to do it at the same time that the sun is setting. This way our bodies are coordinated with the earth, and that gives it an extra little yummy bit of spirituality. Now, if you are waking up with some anxiety, it's usually better to have your experiences during the day. But if you're not struggling with that, then go for the evening. I prefer the evening. I prepare myself completely for bed so that afterward, when I'm doing my integration, I am already prepared for the next event of the evening, which would be going to sleep. So you do you, but that is just my suggestion. So now let's talk about the prep. We want to brush our teeth really well before if we're using the troches or the powder tabs. All right, so we want to brush our mucosal membrane, which is everything inside of our mouth. This heart, the inside of our cheeks, the roof of our mouth, the tongue. We want to get all of that cleaned up, just in case we have a little lunch left over or we have some sort of coating that's going to prevent the medicine from getting in. So we definitely want to brush our teeth. All right, and then we want to prepare our space, like we had talked about setting. Whatever you have decided for setting, that's what you want to do. You want to have the beautiful blankets, the lovely bedding, the incline so that you don't fall asleep. You want to do all of those things. Then you want to prepare. I prepare a tray. And you don't have to prepare a tray. I just find it easier for me. I can put my laptop in there in addition to my medicine, my glasses, and everything that I need. You'll want some sort of spit cup. I use a plastic one just so that we're extra safe and we don't accidentally break anything. You want to take your nausea medicine. If you're taking nausea medicine, if the doctor prescribed it to you, you want to go ahead and take this at least 15 minutes before, but I have done it as early as right before and haven't had any trouble. But if you're prone to nausea, please follow the package instructions. Please do what your doctor said. But we definitely want to take the nausea medication if we're prone to nausea. Then you want to get, if you're doing the troche type or the pill type, whichever, you want to go ahead and pop out your dose and put it into your dosing cup. Okay? So now you've got it in your dosing cup. Now all you have to do when it's time to dose is just gently tip it back and you're already ready to go. Okay, if we're doing the troches, you can cut them into smaller pieces and put them like one up here, one here, one here, one here. It'll soften them up a little bit, and then you bring one down at a time with your tongue, with your mouth closed, and you're going to want to chop on that just the tiniest bit. And then you bring out the next one and the next one. Now, I've also had clients just put the whole thing in their mouth and just chomp it up there. We don't want to get it in our molars, because if you do, it's going to be hard to get it out. So we want to use the front teeth to chomp it up into little bits. As soon as you start chomping up into little bits, it starts dissolving in your mouth, and then you kind of have this like slurry in your mouth. It's pretty uncomfortable, I'm going to be honest. A lot of people find it very numbing. The taste isn't that great. They do put flavoring on it, at least for Better You puts flavoring on it, but it really doesn't help that much. So the best thing to do is to distract yourself. So what I do is I like to put on a beautiful video. I like a fractal video. You can look that up on YouTube. There are all kinds of fractal videos. Or perhaps a beautiful art film, a beautiful animation film, something without words, something that is just beautiful and visual, so that way it can get you into that space that you are getting ready to have this beautiful treatment. Okay, so that's what I do to distract myself. I know there's people that don't do any of that, and I find this medicine to be very sacred, so I am going to do everything I can to facilitate it. I also like a clock. Since I am using my laptop, I just pull the clock up and just put the timer on as soon as I put the dose in. Now, some people will swallow according to what their doctor has suggested, and some people will spit. And that's all up to you and your doctor. I'm not part of that. But I can tell you I do swallow sometimes, not all the time, and I usually only swallow about half. I don't swallow the whole thing. I know I don't have a measuring cup in my mouth, but I get a perception of what I think is happening that moment. Other people will wait until they feel the drop and will not use any kind of clock. Well, since I know that I drop at about 15 to 18 minutes, I like to kind of keep an eye on that. So when I'm seeing it, I'm like, it's coming soon. And when it does come, that's when my body kind of just goes, okay, it's time to surrender. Let's put on the mask and relax and enjoy the experience. Now, everybody is going to be different on this. So that's what I want you to figure out on your own. And that's what you need to do when we have these take-home kits. There's going to be some people that are just going to find the dosing experience to be almost unbearable. And if that's who you are, then I don't know if a movie's going to distract you. But you have to be willing to go through this hard 15 minutes so that you can get to the journey, which is the healing part of this journey. After we have all of this in place and we're watching our beautiful movie, we definitely want to put on either our headphones or our earbuds. Okay, I prefer to use the earbuds because I have broken headphones in the past because you are very wobbly. And if you're like clumsy like me, I broke my headphones. So this is a new pair. So these are my earbuds. I prefer them. And I like to put the music on while I'm watching the art film. Do you see what I mean? And I'm viewing the clock. Now, I don't have to worry about my music because it's already on. Do you see what I mean? So that's easier. It's one less thing for me to have to do. So I want to put on my earbuds before I put my troches in my mouth, set up my clock, put on my little movie that I want to enjoy, push start, and then I begin dosing. So I take down the little troches one at a time, bite them up into tiny bits until I have a slurry of saliva and the medicine. And I'm just going to gently swish that in my mouth. What does that look like? It looks like this. We want to go all the way up here, all the way down here. Tilt your head back a little bit, get the back part of your throat. We want to use all that mucosal membrane so we can get as much delivery as we can get into the mucosal membrane. We're going to swish until we feel the drop. If you're using a clock, you'll start figuring out what your number is. My partner, his number is only about 9 to 12 minutes. So he usually will have start his experience before I'm starting mine. If you're doing this in a couples format, you might want to share music together. Me and my partner, we hold hands during our experience. And that way, when we're listening to the music, if we feel something, we can kind of give each other a little squeeze and we can kind of like bookmark that moment. But you don't have to do like that. You can do your way. These are just suggestions that I'm giving you because what I want you to really realize is this is sacred work. This is the work of the subconscious mind. The part of you that wants to give you guidance. There's a lot of wounds in your mind. That's what brought you here. Either the depression, the anxiety, the OCD. That's what brought you here. So we have to listen to the mind so that way we can understand what our journey is all about. It's not going to be scary. Most things that are presented to you in a very gentle way or matter-of-fact way. Some people don't have anything presented to them. My experiences when I close my eyes look a lot like a fractal video that you might find on YouTube. But they kind of evolve within those fractals into other images. And then there's another fractal in there. Now that's what my experience is like. But the first few experiences, I felt like I was in a boat moving very quickly. And all I could do was look around and see things. And it was all fractalated and pixelated, and I really didn't know what was going on. It took about 2 or 3 sessions before that boat slowed down, and then I was more of a floating out of body or a drone experience or something of that nature. Some people won't have any visions at all. Some people will only see darkness. Some people, it will feel more like a meditation. And then other people, it's going to be more of a visual experience. And they're all correct. And here's another cool thing. Not every one of your experiences is going to be the same. I've had experiences that were dark the entire experience, and then I've had some that were so vivid with one color, yellow, throughout the entire experience. This is what it looks like. It looks like something different every time. Your mind is healing, and that's going to look different in your visual space during the disassociation. Some people don't have any of this at all, but it is not as common. Most people are going to have an out-of-body experience that looks into a different realm of their mind. I remember the experience that I had where I saw my own mind and it said to me, this is what we think like now. And it had multiple minds sitting there for me to view, which I took as that I don't have to think the same way I used to think. There are choices in how I think. I don't have to be person-centered. I don't have to it doesn't always have to be about me. Everything isn't about somebody hurting me or doing something to me. It's more about How do I protect my peace? How do I get myself in those spaces where I can experience more joy? That's where my experiences took me. Your experiences might take you somewhere else. And is it correct? Yes. It's all correct. We're all different. And that's the whole point of the medicine. It helps us find ourselves again. Often we have been cultured in a way that we do not know who we are anymore. We've been performing for years. We don't have any clue as to who we are and how we're supposed to be for ourselves. That is what ketamine will do for you. It will help you find your way back to self. That has been the experience of my practice, and that was my own personal experience. Now, I hope this was helpful to you. If you did like this video, this is a brand new channel. Please like and subscribe. I am trying to heal communities. That is my mission, and I can only do that with you. So please write comments in the comment section so that I know where you are in your journey, and I can figure out ways that I can help you make your journeys more valuable and have more of the experiences that you're looking for, because I want you to get all of the healing benefits that you can. So thank you again for joining me. Thank you again for giving me both your heart and your head. And I look forward to talking to you again, and let's stay intentional.